Good morning, everyone. We'll be starting in just a minute. I'm just going to let everybody else get into the webinar before we get started. Alrighty, we're going to go ahead and get started. Good morning, everyone, and welcome to Webinar Wednesday. Today, we will be discussing physical and mental health in the workplace. This group does not need an introduction. We all know Anna Maria and Janelle from the Gehring Group, and we're so happy to have them here with us today. They're our Diamond Plus sponsor every year, so we always want to thank them for that. And just a reminder that registration is now open for our conference in late July, early August. So check out our website if you're interested in attending. For questions, anything like that, go ahead and enter them in the chat. Throughout the webinar, they'll be answering questions. Again, let's welcome Anna Maria and Janelle.
Morning, everybody. It's great to have you with us again, or us be with you, I should say. Been a busy 2022, an early start, and I am already challenged. Let's see if I can get rid of this. How do I get rid of this?
We see your screen perfectly, Anna Maria.
Oh, you do? Okay, great.
Yeah.
Because I've got this little thing on the top. Anyway, Anna Maria Studley, Director of Client Development for Gehring Group. And this time I've brought a really amazing woman who is our Senior Wellness Coordinator, Joelle Cantor. So really excited because many years ago with wellness, Joelle had the foresight to start looking with me into the mental health arena. So she also is nationally certified as a mental health first aid trainer, and super excited to have us both with you. With that said, we're going to start with Joelle sharing some of the things that we've been doing and best practices, and start getting this dialogue going. We would love you to be interactive as always. We're here to answer questions, so it's your choice if you want to wait till the end or ask them throughout the presentation. With that, we're going to get started.
Thank you so much, Anna Maria. Like Anna Maria said, I'm Joelle Cantor. I've been with Gehring Group almost 6 years now. I know a lot of you on here. I see a lot of familiar names, so that's very exciting. I will try my very best to monitor the chat. So if you have any questions or comments, feel free to drop them in there. And we're going to make this interactive too. So there will be some things we'll ask you to put in there. So today we'll be talking about physical health and of course, mental health as well. But we're going to start off with just redefining health and wellness. And why do you offer wellness to your employees? That's really something that you have to look inside for. The old side of wellness was the absence of wellness, the treatment, modification of diagnosed, and it was about the care. Now we're looking at the inclusive concept of health as vitality, energy, and positive thoughts. Of course, helping the healthy stay healthy, and then bringing the high risk to medium risk, those medium risk to low risk. We find that most important. The key word in wellness now, I bet you all know what I'm going to say, prevention. That's really what we're going to be focusing on. And that's where we want to grow with wellness. We can go to the next slide, please. Now, I know many of you on this presentation have a lot of the things that we will show here. And for those of you who don't, these are great ways to get started. Even if you have a lot of these, you want to revisit them. Sometimes you need a fresh start, especially after our last 2 crazy years. That's okay to just kind of refresh your wellness program. So having wellness ambassadors are really key. It could be someone who loves wellness. It could be someone that doesn't, because they may have other feedback too to share. So that's really important. And of course, including leadership in this. You want leadership on your committee. You want wellness to come from the top down. That is the most important. Of course, Name That campaign is something really fun to get employee buy-in. We want employees to be part of the programming, and it's not just us giving it to them. So have a little fun with it. Have them submit name ideas, have a competition, and then those ambassadors can go ahead and vote and give prizes out. If any of you want to share in the chat your wellness program name, just to give some ideas, feel free to do so. Ours internally is well on our way to better health today. And then we'll kind of change that around if we have a steps challenge, well on our way to more steps today, more hydration today. And then you create a logo for it. I think it's really important to have that logo on information that you're putting out so employees know that it's wellness related. I see someone put in healthy is the new wealthy. I love that. And moving on to surveying employees. So that's really important to combine what they want to see in a program with what they need with those biometric screenings that we'll talk about later, claims reporting, all of that, but really seeing what they want so you can give to them things that they suggest. Again, that employee buy-in is so important. With the calendar events, you always just want to have a plan laid out. Maybe not an entire year because that's hard to do, especially with what we've seen recently, that things are always changing and evolving. But try to have, I would say, at least a quarter planned out in advance. So right now we're in March, try to get April, May, and June planned out just so you're not scrambling for different topics or things, but get them in there so you have something that employees can look forward to. And just always look ahead at what's coming up. Incentives, the big one for employees. What works for your employees? Every organization is different. I would love, again, in the chat, if you want to share some of the incentives that work best for your population. Maybe someone could grab a really neat idea from that. I will say money talks, of course, everyone wants money, but what else can we do? PTO, are you able to give out some extra PTO hours? Because that's always a fun one. Giveaways and even events. You could give things such as like a spa day or take your employees bowling. I think those are always fun and it makes it an event for everyone to get to do together or someone with their spouse, get everyone involved. But yeah, I'd love to see some ideas in that chat if you want to share. Fitness class reimbursement, love that. And even for the gym reimbursement, thank you, Tracy. That's a really good one that we're seeing more and more. Feel free to keep sharing as well as I keep going. Of course, the biometric screenings, just remember that these are not a one-stop shop. This is not what employees should be doing end all be all for their wellness and getting those blood draws. It just encourages employees to visit their physician, take those results with them, and just get a snapshot of their health is really the most important. To not, if employees aren't going to the doctor at all and they're doing this, at least it gets them started and then encourages that. So that's really, we want them to build relationships with their primary cares, of course, but at least if they're doing one little thing at these on-site biometric screenings, that helps. And ongoing reporting and review constantly has to be happening. And then you have to learn to pivot your program when it's needed. Some things will work, some things won't, and that's okay. Don't feel ashamed if something doesn't work. I've done trial and error so many times with our internal program, with our clients. And sometimes you just say, oh, this is a great idea. We're going to keep doing this every year. But this one little thing didn't work, and that's completely okay. You also want to combine that reporting with your medical claims and prescription claims, of course, and Anna Maria will get into that later too. So now we get into the long-term plan of your goals. So this is where a lot of you may be that I know some of you who have wellness programs in place already. We like to call them phases versus years because not every entity goes year one, January through December, the next year. It's just phases. Some will take 6 months, some will take 18 months, and that's okay. So phase one, you could see most of this is what I just discussed, and really talking about the why, getting started, and starting with health promotion of everything listed in phase one. Then comes phase two. So this is where you really want to get into incentives for the health screenings and preventive care. Maybe you have a menu and employees that complete going to their annual physical, their skin screening, vision, dental cleanings, all of that. You could tie that into incentives too. Just completion, no outcomes based quite yet. but just that they're going to their preventive visits. You could also tie it into HRA or HSA funding. Like we said, we know that money talks, and that helps that the spending that they're earning is going to their healthcare when it's tied into those accounts. So that's really important. If gift cards work for your employees, you can always consider local pharmacies, Walgreens, CVS, Publix. And the reason I say that is, yes, they can go and purchase other items at these stores, of course, but encourages them a little bit to really spend on the healthcare because they earned it through wellness. And then we also talk here about non-tobacco. So this would be, I always suggest to start with signing an affidavit before testing, and then always offering an on-site tobacco cessation course as an alternate. That must be offered, and it must be during work hours for employees to attend. Of course, if they can't, they could attend one in the community, but it's so important to remember. Unfortunately, an employee can attend one of these classes, walk out that front door, and smoke still, and they still earn the same incentive. So just remember that with the affidavit and the testing. Phase 3 goes more into the outcomes based. And I know some of you on here have already hit that. And that is, you should be really, really proud of getting to outcomes based. And what that means is just getting employees to achieve their biometric goals and increasing, whether it's decreasing their glucose, decreasing their blood pressure, BMI, whatever it may be, and hitting specific goals. With outcomes based, you have to have alternates for all of them, not just tobacco cessation. So if somebody, for some reason, can't lose weight, or if they can't lower their blood pressure due to genetics, you still have to offer that alternate for employees to earn the same incentive as everybody else. So that could be through a clinic if you have one on site. It could be through your medical carrier who offers, educational videos or on-site sessions. There are a lot of different options. If anybody wants to share what you're doing for outcomes based, we would love to hear that too. But there's a lot that you can do here. And please don't rush outcomes based. There's no need to rush it. I say my recommendation is usually from the launch of a program to outcomes based, 3 to 5 years is usually, what your goal is. Don't forget, if you have any questions, feel free to put it in the chat as well. Now, hybrid. Now that this came into play the last 2 years, of course, with on-site and remote options. I know most of us are back into on-site, but you may still have those employees that will continue to work from home or be back and forth in the office. So just remember everybody and make everything inclusive. So wellness communications are so important. And as much as you can, whether it's you're posting it on those boards for those public works and those guys and gals in the field, but also email where they could see it. Maybe you have a little teams that you could communicate through, but communications, we know employees really have to see something around, they say 7 times for them to hear it. So that's getting it out a lot of different ways. Virtual fitness classes, virtual lunch and learns, whatever works for your employees. And I would say if they can't attend, they're not virtual, they're still in the field, record those sessions, offer them afterwards and say, hey, you could watch this whenever you want. It's just making it all inclusive for everybody. Screenings, of course, can still be offered, bringing them back on site, even if they're working from home sometimes, and then still having the screenings on site. And there are actually screenings now they could do at home. It's not everyone's favorite because who wants to prick their finger at home? But just close your eyes, have your child or spouse do it. And, you could still get that snapshot of health, which is really, really important. And share. Educate employees. It's the most that we can do with what has been going on in our lives. Provide podcasts, educational materials, new monthly books. Anything that you want. YouTube has so many videos on stretching and yoga, everything. So I feel like you can't overshare. I know we're all worried about sending out too many emails, but if you do it once a week or once a month with everything in there, I think it really helps for one person to just find something, oh, I need that in my life, find that really important. And of course, challenges. Challenges can be hosted anywhere, anytime. Employees just need the information. And a tracker, they could fold up the tracker, put it in their wallet and take it with them on the go. that you could do hydration, steps challenges, mental health challenges are coming into play now. Even habit challenges. So, read a book every day for 30 days, whatever it may be for employees that they're looking for. Again, you tie that survey back into. Keeping employees engaged is so important. And I would suggest not to offer more than one challenge per quarter to just not burn out employees. And here you can see some really fun ideas that we've come up with. Feel free to take notes and steal these ideas. They're for sharing, of course. You could offer steps challenges, walking meetings are always a good one. Unplug challenges. What we did internally, which is a fun idea, is pick an hour to unplug from 7 to 11 p.m. every night, whatever that may be, taking a walk, hanging out with your kids, no phone at dinner. And no sleep doesn't count. We had somebody ask, well, if I go to sleep at 9 o'clock, does that count as my unplugging? And I said, no, I got to do something before. Just do it for your own mental health. It's so important. Headspace is out there. They have corporate accounts now, and then bringing on-site vaccines. And then we have some more samples on the next slide as well. Bring your own lunch. That should really have an H in it. So it's bring your own healthy lunch, because we've seen what some employees can bring in. Maintain, don't gain challenge over the holidays is really fun. Maintaining within 2 pounds. And of course, the mental health, keeping it easy with just having adult coloring books in your break rooms. Those are always fun. Let someone veg out for 5 minutes and focus on it. And of course, the most favorite, chair massages. I'm so excited because we're bringing them back for the first time next week on site here since COVID. So we're so excited. So I think just getting things more in person again for employees to get excited about for wellness is really, really important. And now the not so fun stuff is the legislation. I call myself and my colleagues Miss Debbie Downer Joelle sometimes, just because I have to always put this out there. And sometimes I have to say no when I don't want to. But those ADA disclaimers. So still just make sure you're having it for all activity-based programs, such as if you have a STEPS program for ADA, you must have that alternate available. You don't necessarily have to come up with that alternate beforehand, but as long as you have the disclaimer, an employee can request it. So that's fine. And then for outcomes-based, as mentioned earlier, they must have the alternate listed. So please remember that. Even with virtual hybrid programs, these all come into play. So that EEOC notice must go out annually as well. And that is when you are incentivizing for either or biometrics or a health assessment. So make sure that you get that out and you're still putting that out there no matter what, virtual or anything. And then the one thing that's not listed on here, but I'm going to chat about is taxing. I always have to mention you tax those gift cards. Some entities don't have a minimum. They tax on every little item. And mostly we see $25 or above. The IRS does not list a de minimis because they like to make it tricky for us. So I like to just put it out there. $25 is usually a great threshold. I do see a question in the chat. So first, I think we'll be getting a copy of the presentation. Babette confirmed that. Where do you find the different ideas for challenges? And do you know of a company who can manage the process? Great question. So ideas for challenges, we actually have a whole list of ideas that we could provide to you as well. So we'll make sure to get that out and you could always reach out to us. But no problem there. And then a company who can manage the process. There are many wellness portals out there that have that. So I know some that are available where they have their challenges embedded, and then it's tracking. And again, it's all self-reported. So you have to remember that, you can't track hydration or how much somebody is drinking. So on wellness portals, most of them will embed challenges there. I see someone made a suggestion in the chat as well. So if you're using your own portal for challenges, feel free to put that in the chat to help everybody else. And moving on to achievements and awards. So these are some wonderful ones out there listed. Healthiest employer, best wellness employer, worksite wellness, Bell Seal through Mental Health America as well. I'm happy to say that Guerin Group has earned all of these awards. So if you have any questions or are applying, feel free to reach out to me. I'm very happy to help. I do know that the specific, the South Florida one for Healthiest Employer, the deadline is coming up to March 31st, as well as that Bell Seal. These are all national program. The two are national programs. The other two are Florida only. But the Bell Seal application is about to end, I think, the end of this month as well. So just make sure you're looking into those. And if you need help, I'm happy to review and chat with you a little bit. But these are wonderful awards. So feel free to write them down as well. And now moving on to our major discussion point of the last 2 years that we've had is mental health. Right here on the right, I just want to mention these resources are so important. I would love if you all could just take your phone out real quick, take a picture of these. It can't hurt to always have them available. The top two in the blue, the National Crisis Text Line and the Suicide Prevention Hotline, I recommend adding those numbers in your phone right now. You never know when somebody else or yourself may be in need, and you could just send that number to them, send it to their phone, read it out to them, and get them help, immediate help. I recently became a counselor for the National Crisis Text Line, actually, and that is all online texting only. Really great resource to bring someone from a hot moment to a cool one. So if you guys can just take a quick moment and save those to your phone, that would be wonderful. And now going into the Employee Assistance Program to start, EAP is a tricky one because employees hear that word, and if they've tried it and didn't love it, they have this bad connotation with it. So just want to be open with your employees. How do they perceive EAP? Do they find it useful? Is it the first place they reach out? If not, find out why and how we can change that. We want to give them the resources that they're willing to use. So make sure to include those types of questions in that survey and just talk with employees. Talking is the best way to get that information. Make sure you're connecting with your colleagues on a regular basis. All of these are listed here, yes, for your employees, but for you too. Mental health, we try and we seem to take care of everybody else, but take care of yourself first, because then you can't help anyone else. So take these in mind for yourselves too. Encouraging breaks. Right now, there's a lot going on in the world. Part of that Unplugged challenge, you could include stay off social media for a day, stay off the news for a day. Don't put that news channel on for a little. I know we all want to stay in touch and it's wonderful, but sometimes we all need that well-deserved break. So just keep that in mind. As mentioned, taking care of yourself, find what works best for you. Is that eating healthy? Is that working out? Is it getting that 30 minutes extra sleep in the morning or going to sleep 30 minutes early? Drinking a lot of water, of course, avoiding excessive alcohol and substance use. Whatever works for you, reading a book, it's different for everybody, but find what works best for you. And of course, making time to unwind. So group activities with your coworkers is wonderful during work and after work. I talked about going bowling with some colleagues. Use those wellness funds, go bowling, have a fun day with it. We don't have to be so 8 to 5 with our colleagues that are also become friends. And just remember that we're all here for each other. And if you need anything, Anna Marie and I really do have a lot of mental health resources and knowledge with our training. So please don't ever hesitate to reach out to us on mental health. It is our absolute passion. And at this, I'm going to pass it on to Anna Maria to dive into mental health a little bit more.
Thank you. I want to point out again something very important. You all are amazing at taking care of our people and our communities. Please network and be there for each other, or reach out to Joelle and I or Babette. We're here for you because somebody needs to take care of you, so you stay strong and that you are cared for. It's kind of like the airplane when they say put your mask on before you start helping others. We want you to keep your mask on and make sure that you keep yourself as a priority in the mental health arena, especially with everything that's gone on the last couple of years. So I am going to talk about the numbers. A lot of times when we see that you all have passion, one of the biggest challenges is to get your leadership on board. And it is, as Joelle said, extremely important in any wellness initiative, let alone mental health, that there is that transparency and that it comes from the top down. And that includes your top leaders, your elected officials, and you and your other directors. So these are the numbers. NAMI is an amazing organization. It's on that list that we provided you on the prior slide. They have actual county and regional offices. They do a lot in the community. Joelle and I teach for them on the mental health first aid that we did last year at the pre-conference. They are amazing in having access to resources so you can tap into them in your local area. Some of these numbers throughout the United States, again, we still have about 1 in 5 adults experiencing a mental illness. Sometimes there's more than one. Over 12 million have had serious thoughts of suicide over the past year. This is status as of December 21st. That number's gone up, and you'll see that the word serious is now involved, because in the past they only tracked thoughts of suicide. So this is a little concerning, but it is very correlative of what we've seen with the unrest, and now with what's going on in Ukraine and what we've seen through the coronavirus up and downs. 26.3 million adults receive care via virtual services. And I'm going to touch on this again in some ideas. Please do not dismiss the virtual options with anything that you're doing, especially mental health. You have people that are shift workers, you have members of the family that are covered dependents of your program. Just because we are pulling out of the virus and everybody outside of you, because you never stopped working as essential workers, are starting to come back out into the community. Virtual is not something that you want to throw to the side. You want to find that right balance with your resources to try to balance in person and your virtual services. 18% of adults with mental illnesses also have a comorbidity. We've talked about this before, but the number is going up a little bit, where there is an alcohol or a drug addiction. And a lot of it is about self-medicating and just not knowing how to cope or find resources. I also wanted to correlate the impacts to the medical well-being. A lot of times we'll see correlation of mental distress or depressed anxiety, where it starts exacerbating itself into medical situations, high blood pressure. And you'll see here that we have a 2 times higher cost and frequency with cardiometabolic disease, especially when we have serious mental health illnesses. Wanted to drill down a little bit here, because this is something that, just like with our preventative medical, when we started it, all of a sudden there was a shortage of PCP and slots for the biometric screenings to be done at the Quest and the LabCorp and so forth. As we open up our cultures and awareness within our organizations, we are now starting to see a shortage of clinicians. So I thought this was a very interesting bunch of stats within the United States of adults receiving mental health services. There were about just shy of 18 million that are experiencing delays and or cancellation of appointments. We're also starting to see burnout with our clinicians, which is pretty interesting. 7.3 million had delays in even further in obtaining medications. Again, if you're being given a medication for mental illness, you absolutely need to see a psychiatrist. A psychologist, a social worker is not going to be able to prescribe those meds. And the psychiatry is where we're seeing the backlog. And we'll talk about Florida, because a lot of that is also around our PTSD legislation with our first responders. Just shy of 5 million were not able to access the care that they needed. And this, again, is a global statistic, so it's not specific to public sector, and we know that benefits are really strong in your arena, but this is including those through the marketplace and the private and those that are uninsured. Again, drilling this down to specifically us in Florida, 40.8% of adults reported symptoms of anxiety and depression. Sometimes we see both. If you start with the anxiety, it may lead to a long-term depression, but this number again is creeping up a little bit. More than half did not receive treatment, and this is discouraging. And we'll talk about that. And that's why Joelle was talking about frequency and different approaches when you're trying to reach out to your folks for both physical and mental resources. And in Florida, the statistics through NAMI are that Floridians are over 5 times more likely to have to seek care with out-of-network providers. So we've been doing a lot of specific engagement and direct contracting. If you have a health center, we can put it through there. But there are quite a number of ways, including developing a client-specific network if you're self-funded, to develop your own programs and specific like concierge providers for your membership. So let's talk about the top issues that have come up in the last 12 months with employee mental health. You'll see that I've highlighted COVID, but I do want to talk about this works-related stress. You guys never stopped, ever. Everybody took a pause. We had to stay at home. You and your teams did more than you ever have. And we're really, really proud of all that you've done and appreciative. But it is because of the length of this duration and I'm shift A, I'm shift B, I'm home with my family, I got kids that aren't in school, now I'm back out, all the various phases that we had of coronavirus and the Surfside building collapse, social unrest that you're dealing with both frontline and just as a community, they're all impacting us. Economic uncertainty, and we'll talk about some of this is to provide financial coaching and resources, either expanded through your EAP, or there are other resources out there directly. Family relationship issues, if you've been locked at home with your family more than you ever have, you're kind of getting on each other's nerves. So that has impacted. We have young adults aged 18 to 25 that are reporting that the pandemic negatively impacted their mental health. 50% of them had significant negative impact. So look at your workforce. Something that happened, again, we saw another cycle of those that were in drop that left, and those that were not, that said, you know what, I'm over my time, I'm done with all this. So now we're hiring new people coming in, and they tend to be of the younger generation. We saw an 18% increase in use of alcohol and a 19% increase in use of illegal drugs. Again, the depression, the anxiety, sometimes we're self-medicating and there's a comorbidity. Your younger workers are struggling. It's not just your Gen Zs. As you'll see, the 71% of the correlation. Usually I, as a baby boomer, get hammered on statistics. Looks like we're doing okay, but we're on our way facing to the end of our careers. Gen X's, you can see a little jump. Millennials and Gen Zs are the ones that you don't want to forget when you develop your programs, because these are your up and coming superstars and the people that you attracted, went after, and you want to retain as good performers as your next up and coming level of leadership. The impact to employees, if they go untreated, we already talked about the physical health implications, especially from internalizing the stress and the anxiety. You will experience the absenteeism. I also warn of presenteeism. They could be there, but they're completely not functioning or not functioning at the level that you need. They're on the phone all the time. They're stepping out of the office. Those are the signs that you can see when you can walk over and see if there's something going on deeper than just the normal stress of a work. Conflicts at work. We've seen increases at conflicts at work. You are frontline on this. I'd be interested to hear in the chat if you're experiencing any of these and seeing this, especially over the last 12 months. And then most importantly, all of this rolls up to potential impaired decision-making, which is never where we want to be as employers because of the fact that they either don't realize what they're going to, and you kind of just need to tap them on the shoulder to point it out and refer them to a resource or a community group, or if it's at that escalated level, we want to try to get in front of any attempted suicide and so forth. Let's talk about case studies. So we took some of our largest public sector employers, and I want to put some real numbers to this. So this is for our Gearing Group book of business, not our entire book of business. These are the larger, more self-funded groups where we can actually see every single visit, every single touch point and use. through our analytic tools. So this is where over the past 3 years, 2019, 2020, and 2021, we had a claim spend, and the data set is 60,000 members. This is down to the belly button because this is impacting not only your employees, your retirees, but your dependents. There was just shy of $14 million spend on medical for mental health and substance use for these 60,000 members, and a little over $8 million in paid pharmacy. So what I wanted to do is drill down to a per member per month cost. And you'll see just in the more recent 2020, your medical was $630 and your pharmacy was $413 in this data set. You'll see medical bumped up in 2021 and very slightly in 2021 for pharmacy. But look at the number so far that we have for January claims. We have almost doubled in our spend for mental health and substance use. While pharmacy and the medications, because of all the new contracting and the carriers and the TPAs buying some of these pharmaceutical wholesalers, we've been able to manage that cost. Now, I and Joelle want to caution you, just because our spend on the medical side for mental health went up and almost doubled, I don't know that that's necessarily a bad thing. With awareness and opening cultures and providing more resources and network opportunities and better benefits in the mental health and substance arena, I think this could be good. That means that people are starting to go for help more often. So you're going to want to look at your data and see specifically what's going on in your group if you can. And you can use that, as Joelle said, other than the biometrics and the survey, to kind of look at it holistically to see where they're actually using their services. We also can identify a lot of gaps between what they're telling us they want, what their biometrics tell us they need, and what's actually happening in the health plans. Mental health on this data set for top conditions: depression, anxiety, bipolar actually came up in the ranks, drug dependency and alcohol dependency. Again, of these 5, 4 of them we typically will see leading. The top place of service: outpatient hospital, emergency room, office setting, and inpatient hospital. And these are in the rank from top to bottom. I would tell you that based on what we see in our data, they're going to outpatient hospital facilities. That's great. There are so many, especially in the mental health and substance use arena. I would like to see a reorder of this. I think office settings should be first, outpatient hospital, inpatient hospital, and emergency room should be at the bottom. It's just like a medical condition. We want them to go if they need it and they're in crisis, and sometimes we cannot avoid it. There's sometimes also emergency room is skewed by drug addictions and or overdoses, and then just alcohol poison and people that are at a really bad place or are found during blackout sessions. Mental health, again, let's look at the demographics. What's interesting here is we're seeing a 50-50 split in these 60,000, where our dependents and employees are using the program equally. On the age, I thought this was really interesting. We see the under 30 set, and it looks like they're leading in the use, but if you split that under 30 to go under 20, age 20, 13,000 members under age 20 sought care, 20 to 29, 10,000. So it's interesting. We go back to the under 20 and the younger generation that's coming in, those Gen Zs, those millennials. They are the ones that are more open and using the care in this under 30 set, but most of our utilization is coming in the 50 plus. So I'm going to point out that that is the #1 age group and membership that's utilizing mental health and needing substance use care. Don't forget your retirees. We are working and planning, instead of just doing an exit interview for retirees at the month before they're going to leave, we want to try to be 6 months, 12 months out with the planning. Remember, a lot of their definition and our definition of who we are is what we bring to our work family. And all of a sudden that's disconnected. And for a lot of you, that's disconnected at an early age. So they still have to work or possibly engage in the community. And we want to make sure that we help process them. With the gender, we see 31,000 males seeking care, over 29,000. This is really good because we all know it's hard to get guys to go for help. So we're super excited about these stats starting to come out. I'll go really quick. Risk by plan spend. This is over the 3 years. You'll see this is where we are taking the data and we're putting it through their risk levels, because our goal is if they're very high, we want to get them to a lower level, high or medium. Medium, we want to go to low, and low, we want to keep in the low. So the actual plan spend, you can see that the majority of the spend is in the high category, not in the very high category. That comes second. So again, just like physical, we want to get in front of it. Now, when we put it through our analytic tool and we see the type of care that's being seen, the good news is that the emerging risk, the look forward, you'll see that the low and medium go up and the high and very high go down. What's really cool is the very high goes down significantly in the projections. And that's where we see more critical situations that we want to address. In this emerging risk, the top conditions are depression, anxiety, bipolar, drug dependency. The number of members that are diagnosed with anxiety lead the pack in this spectrum. However, the actual per member per month cost that leads is for treatment of bipolar. So that was pretty interesting. Want to talk a little bit about a national survey that there's a bunch of them out there. One of the things that we want to do is keep surveyed on any disconnects that you may be having. Just like when you're dealing with employee evaluations, you and the supervisor may have a totally different perspective as the actual person who thinks they're doing a good job. So when it comes to employer support for mental health, especially with frontline employees, 71% of the employers on this survey through McKinsey and Company thought they were providing enough support. 27% of the employees felt like they were getting enough support. Let's go back to the access of mental health providers. Employers have now 31% are making it a top priority to make sure and measure and remeasure whether their people have access to providers and to the right providers. Employees, 67% said they're having problems finding providers that they can engage with. When we go over to the stigma in the workplace, employers have implemented awareness campaigns. 23% of the total population of employers, and this includes private, I know public does a lot better, 23% have implemented these campaigns. So if you have not, you want to make sure that you're doing that as you plan over your phases. 79%, just shy of 80% of employees feel that awareness campaigns are valuable. And when you look at comments, they find them extremely valuable. They forget that this stuff is available, especially when they finally see that they need some help. Some action steps. So we gave you a lot of data. You need to make mental health a priority, and that is starting at the leadership level. You want to look at your programs. The old canned EAPs are not doing it all the time. Make them give you utilization reports, online resources, phone resources, rate of closing those cases. You want to have a variety of options. Your folks will have different needs at different days. It will be different by person, and their crisis level can change. Communicate often. Make sure it's not one and done. If you're doing it only at open enrollment, they aren't listening. They want to know what you're doing on the medical. Is the plan changing, and is my rate going up? And do a lot of education and training. There's so many resources available. Again, Joelle and I are out totally open to helping you. Make sure it's a culture of inclusion. We've seen a lot peer-to-peer happen in first responders, but we're seeing it a lot throughout our cities and counties and special districts. There are many levels of peer-to-peer, and one of the things we're encouraging you to is to just engage with your peers. It is a community challenge. It's not an individual challenge. I will tell you, when I look at statistics throughout the world, other countries, and we see the attempted and completed suicide rates going down, a lot of it is attributed to the fact that they approached it globally as a community challenge and didn't do the individual. So people felt more open to go for help and not that it was their burden alone. And then, as Joelle said, do surveys, do assessments, measure, be open to adjustments and future enhancements. If you got some momentum going, keep it going, mix it up and measure to see if the existing programs are actually ones that people are utilizing, why they're not utilizing it, and how to make it better. Again, mental health is not one and done. Think of it as a spectrum of resources, not you have to go here first. We used to say, oh, your EAP, and then you go to your mental health. They should be able to access anything at any time. You might want to even entertain being a mental health first aid trainer. Put it part of your new hire. Do it as an annual training for your folks. They can get a certificate. It's very enriching, and I always walk away feeling like I got more from the people who attend my training than I provided. Peer-to-peer chaplaincy programs, CISM. We have Public Works. We have we had a completed suicide in an HR office during work hours. Just look at potentially making these available to all your employees. Again, retirement assistance, financial assistance, right? College debt, expenses right now. Anybody go fill their tank with gas recently? People are struggling, and we want to make sure that we have these programs and these training sessions for them. Customize your EAP. They're moving out of the box. There are a ton of direct contracts you can use as resource. If you have a health center, you can put a part-time social worker, counselor through there. You can direct contract for it and just pay directly. If you have a self-funded program, you can build a second level of network that can be adjudicated with all the controls and enhance those provider networks. Again, don't forget about telehealth and virtual. Nobody can estimate when they're going to be in crisis. Sometimes it's on weekends and nights. Your on-site clinicians through your health center, and definitely your resiliency training. And you can get a lot of that the programs through your workers' comp, and sometimes we can get some discounting if they know that you're doing it, just like your safety training. I have to end to remind you with a legislative refresh. On the federal side, don't forget healthcare reform. Your essential benefits must be covered. And I define what that is, no pre-existing, and that equitable benefits have to be provided for mental health and substance use as you do with medical services. And that's where that Mental Health Parity Act came in. If you're self-funded, make sure that if you're not measuring the equitable benefit level, or your consultant isn't doing it for you, that your TPA or your carrier is doing it. If you're fully insured, they have to do it by law. Just make sure that your programs have been tested. So if you ever get audited, you know. And then on the state side, the Senate bill and the House bill for PTSD on first responders, we are involved and know of a lot of individuals working with the governor to expand the PTSD legislation. Again, this is adding to a bottleneck for diagnosis and delaying getting them diagnosed for a lot of our clients. So we want to make sure that you know that they're trying to open that up a little bit without having to run into the challenges that they had with PTSD treatment being covered up in New York after 9/11. There was a lot of fraud, there was a lot of abuse, which is why when we installed this legislation in the state, the governor went restrictive with only psychiatrists diagnosing for work comp. So they're aware that something needs to be done, and they are working on it with him. Okay, so I talked a lot. Joelle, do we have any questions?
We do. So before we get into this scavenger hunt, we have some things. I just want to thank someone in the chat for being vulnerable and opening up about something. So we appreciate you. I do see there's a question about Garin Group. So no, we are not an EAP provider. We are a broker located in Palm Beach Gardens, Florida, and we provide services throughout the state of Florida and actually nationally as well now. We just have Anna Maria and I have a very large focus on mental health, and that's why we discuss so much on that today. There's another question about surveys. When I send out a list of challenge ideas, I'll send them to Babette afterwards. We do have some PDFs of survey samples from robust survey, a moderate, and like a simpler one. It's just a PDF, so you would have to go and create it yourself through SurveyMonkey, or maybe you have another service that you utilize, but you could pull those questions. So we'll absolutely send those samples as well. And for other surveys, I see someone mention the Bell Seal to go by for your mental health, which is excellent. And I think that one will help for the mental health side. And then the ones that I'm going to send out would be more for employees. So I hope that answered those few questions. Are there any other questions that you guys want to put in the chat before we have some fun and spend the last few minutes together? I'll give you a second. And if not, what we're going to do is Babette sent you over a fun little scavenger hunt. You should have received it. Looks like this, a 2-page. And this is one of our challenges that we offer to our clients. So we just wanted to have some little fun with it today if we had some extra time. So I'm going to ask you all to participate in the chat once again. I'm going to pull some random questions. I have my cheat sheet in front of me, so I have all the answers. Sorry about that. Anna Maria, I don't see any more questions coming in. So you're okay if we just go through this scavenger hunt for a few minutes and have some fun?
I absolutely am. These folks need, we gave them a lot of information, so let's have some fun. This thing, folks, when she did it for us, had me scrambling to try to find stuff. So have fun with it.
Awesome. So hopefully you all have this out. And I'm just going to pick random ones. We're not going to go through it all, but it's just a fun little challenge for employees to do. And even if they know the answer or they're using Google, that's the whole point, for them to get educated, re-educated. Maybe it's things we learned in grade school, but just refreshing our memory. And we always say, don't use your coworkers to cheat, just use Google so you can learn some new stuff. So number one, if somebody can put an answer in with regards to blank intake, the American Heart Association recommends no more than 2,300 milligrams a day and moving toward an ideal limit of no more than 1,500 milligrams per day for most adults. Sodium, sodium, sodium in the answers.
Wow,
awesome. That was quick. Good job, guys.
I'm impressed.
Love it. All right, I got to pick a harder one. Let's see. Number 3, true or false? Nutrition fact labels list ingredients in the order of predominance from most to least. The items listed first, second, and third on the list usually make up the majority of that particular item. True. We got some good ones on here. Good job. Yeah, I love that one. If you look at an ingredient and honestly, the top 3, if one of them sugar, put it back on the shelf if you can. If one of them's, erythritol, put that back. So that's really what I go by. And when you see an ingredient list that's like 30 long, put it back on the shelf. Let's see. I know it's harder. It's easier said than done, guys. Number 6, the 2 types of blank are soluble and insoluble. What is this one? Fiber. Oh, someone said fat. It's fiber. Good job. Fiber is so much more important than we realize, and really to track it for yourself. I know we all track calories and protein and fat and carbs, but fiber is so overlooked that it really helps with your health. So keep that in mind. Let's go. Number 9, chemicals produced by plants are called blank. Let's go back to our biology in, 8th, 9th grade.
That was a long way back for some of us. I'm just saying.
No. Go, we got it. Phytochemicals.
Holy
you guys
moly.
are great. I'm just having faith that you guys are just knowing these answers too, and you didn't look them up before and you just know it.
Listen, I know who to go to when it comes to all of this stuff now.
It's great. I had someone this morning come over to me and say, hey, can you look at this ingredient list for me on a can of something? So I love it. I'm going to do
There's
one.
there's times where Joelle, if we have a snack cabinet at the office, she and the others will go in and they will put little dots, green, yellow, and red, to tell us where to stay away from. Even if we have to have it, we make that choice every time we go in the cabinet. So if
And
you're ever
that's
visiting the office, you'll see a lot of really healthy stuff.
And that's my favorite, because when we did that originally, I didn't want to take all the bad stuff away from employees. I wanted you all to make the choices. So, if somebody's looking at something, a red item versus a yellow item, they're going to go for
Mhm.
the yellow item. And then slowly we were able to eliminate those red items because they weren't being eaten as much, because employees were making the choices for themselves. So that's a fun one. We had a dietitian come in and
Yeah.
go through everything for us. And then we were able to stop labeling them all because employees got used to it. We're just going to do one more question.
Sharice wants to know if you could do that at the grocery store. Lord, if she could, I'd have her with me
Man.
all the time.
And
No doubt.
what they do at the grocery store, mostly eye level, they put the stuff either we shouldn't be eating or the more expensive stuff, because you're not looking all the way at the top or all the way at the bottom. Check the stuff out on the bottom shelf. That is most often healthier. And there's lots of tricks in the grocery store. Everyone knows to stay in the perimeter. Don't go down those aisles. They're tricky. I do it myself and I'm like, ooh, I don't really need this, but I really want it.
And don't go
So
shopping when you're hungry.
yes, that's the worst one. Sharice, we'll go grocery shopping together.
Yeah, she'll take you down the aisles.
Absolutely.
Okay, Joelle, Babette signed off. We're about 3 minutes out. So I just kind of want to open it up to the group and just see if there are any other questions.
Yeah.
And if you don't have access to us, Babette can get to us. We're here to help you any way we can. Like I said, we really appreciate what you do and the position that you're in. We know that this is ever changing, which is a good thing, but there are so many different things that come out. We're more than happy to share resources, any of our information, and best practices. So I don't see any other comments, and I will end the way I always do, because we are so thankful for each and every one of you and everybody in your organizations. Our communities couldn't have thrived while others were crashing and burning in this country through the last 2 and even now into this year. Your unwavering dedication and service to our communities and to your people are just bar none off the charts. It just puts Florida so far ahead because of all of you. And we thank you for sticking your neck out every minute of every day. Please remember to take care of yourselves. And if you need help, we're personally here for you. So thanks, everybody. It's been a pleasure again to be in front of you. And if you have any questions or additional information you need after this, reach out to us, reach out to Babette. She'll get you hooked up with us. We're here to help.
Thank
Bye.
you so much, everybody. Bye.